Hi guys, it's Dave. Today we're going to talk about high cholesterol, a condition known as hyperlipidemia. A lot of people will have high cholesterol and will never even know about it until they're actually tested. The best way to do that is at your annual physical or the next health fair that you go to, or right here in the pharmacy, we do lipid panels or cholesterol levels. You can be prone to have high cholesterol by the way that you eat, by how much exercise you get in, as well as, unfortunately, some people are just genetically prone to have high cholesterol. In that situation, yeah, absolutely, you want to eat well, you want to exercise as best you can, you want to make sure you get lots of rest and also drink lots of fluids. However, because of your genes, you're probably going to need to be put on prescription medication. Now, right now, there's several different options out there for you. Some of you that might have just mildly high cholesterol, or you want to prevent from getting high cholesterol, you can do things like, first off, as I said, exercise. Put in at least 20 minutes a day of good physical exercise. Secondly, watch what you eat. Make sure you're getting plenty of fiber in your diet, as well as fruits and vegetables. The 5 to 6 servings of fruits and vegetables a day, for me, is nearly impossible, but it can be done. Something like a smoothie is a great way to do it. My wife started doing that in the mornings, putting vegetables and fruits in a smoothie. You can slam that baby down and get them in right there. The other thing that you need to realize is supplementation can be done. Now, fish oil is out there. It's very controversial. You have about half the studies that say, yeah, you will get results of lowering mainly your triglycerides by taking fish oil, but half say they don't. One way to do that is just eat seafood in your diet. If you can get in 2 servings a week, that will help out. The other thing is make sure you get a good quality fish oil product. I've done a TikTok video regarding that. The more expensive the fish oil is, probably the better it is for you. There are 2 prescription fish oil type products on the market, Visipa and Lovaza. They're both generic now. One of the things you need to watch out for that is you can sometimes get a fishy aftertaste with that. Make sure you store them in a cool place. The cooler they are, the farther they'll go through your system before they're absorbed, which means you won't get that fishy taste, which is another reason I recommend putting fish oil in the refrigerator as a vitamin supplement and then taking them, because it avoids the fish oil taste. The main one that you'll hear about, and a lot of my patients are scared about, is a drug called HMZ coenzyme A inhibitors, or statins. Drugs like Lipitor, which is atorvastatin, Zocor or simvastatin, or rosuvastatin, which is Crestor. That one for me is my favorite one because it's the one that actually has shown regression in plaque, which it's great to stop the production, or not the production, but the buildup of the plaque, which is what they do. But the rosuvastatin actually showed regression in the plaque, which is really good. One of the things you need to watch out for with all those drugs is stay away, avoid grapefruit or grapefruit juice with them. Orange juice is fine, but when you take grapefruit or grapefruit juice, it actually elevates the level of those drugs in your system, making you more prone to have muscle aches, joint pain, muscle pain. If you experience side effects like that, let your doctor know, but something that can be done, they can switch you to a different one. One thing that can be done too is you can take CoQ10, which is over the counter, 100 milligram, 200 milligram, which helps reduce your chance of getting muscle pains, joint pain, things like that. Along with that supplementation of the CoQ10, something I didn't mention that does have backup studies is red yeast supplements, and you can buy those over the counter, and there are several studies that show that helps to reduce your cholesterol. Something else that they are using as well, which is a newer type of drug, and it's an injectable, and it really works well for those patients that have hereditary or genetic high cholesterol, and that's the Pcsk9 inhibitors. big terminology, but they are injections. They're very expensive. Your doctor has to prescribe them, and he'll probably have to do a prior authorization for your insurance. But those are drugs like Repatha or Praluent, and they have shown for people that have either been resistant to the statins and the fish oils, they have brought down cholesterol better for those patients, as well as those that are prone genetically to have high cholesterol. But again, like I say, watch out because they are pricey. Your doctor will have to do prior authorizations. Another forgotten kind of class that's out there is called the fibrates. The drugs mainly in there are you're looking at the Tricor or fenofibrate or Lopid or Gemfibrozil. They're not used much anymore because there are better alternatives, but I do have a lot of patients on them. They mainly lower your triglycerides. You can be on a statin and fenofibrate or Gemfibrozil. I'm not going to lie to you, there is a drug interaction there, and people do try and shy away from that. The drug interaction mainly that happens will cause you to have joint muscle pain. However, if you've been on that drug and your doctor has liked the results that they've seen from that combination, don't be afraid to continue it, but do let them know if you're experiencing joint or muscle pain. Also consider, like I said, if you try supplementation with the CoQ10, it may help that out as well. All kinds of choices, all kinds of information out there, guys. In fact, just recently they've updated the guidelines of what constitutes high cholesterol, where you need to be with your risk factors. If you're a smoker, if you're a diabetic, if you have heart disease, high blood pressure, those are all risk factors to take into consideration with your cholesterol. Overall, the best thing still is to watch what you eat, get out, get some exercise in, and try and see your provider at least once a year to make sure that you don't run into a high risk factor that can really bite you in the rear end later on if you do nothing about it.